force muted and legislated for. We obviously welcome that, but over the last 4 or 5 years, less than 50 people have got access via prescription under the MCAP, and only about 65 people have got it under a ministerial licence. And what we're calling for today, and you'll hear from the different speakers, is that the MCAP should be expanded to include other conditions. In January, the Health Research Board done a study in terms of the efficacy around medical cannabis, and now there will be a clinical review done by the Department of Health over the next few months in terms of whether to expand the programme or not. We've always called for the expansion of the programme to include other conditions, particularly neuropathic pain, because there's a lot of unmet need in Ireland in terms of chronic pain where people rely on opioids, and that's not good in the long term. So there's a number of speakers there going to speak about their own kind of personal experience, why they're here today, why they have a license for medicinal cannabis, and the frustrations in terms of that, and in terms of expanding the program so they can be on the program. Because if they're on the program, then the state largely covers the costs, and that's a much better way than either via the license going without or going abroad, or even worse, going to the black market, which some people have to do, which is outrageous. So our first speaker today is Amy Brown, and Amy will explain why she's here and so forth.
I can report happily that I did find a consultant who was willing to prescribe, who treated me as a reliable witness to my own experience and my own suffering, which was validating in itself, and I got my license. However, my prescription cost went from €1.50 per month to €246 per month. And unfortunately, the only product that's available to me via flower form is actually not very good for the pain whatsoever. So I'm actually paying that €246 every month to keep myself out of court, to keep up the medical label for the cannabis user that I am. So I suppose the reason I'm here is because the MCAP program, it's not fit for purpose as it stands. There are private cannabis companies in the UK, some who are genuine, some who are preying on vulnerable patients, and we want a regulated market with these clinics that we have a variety of cannabis strains that we can choose from and different medicines. I'm really frustrated that the Citizens Assembly left the medical cannabis conversation out of their terms of reference, because as far as I'm concerned, with only 150 patients between ministerial license and the MCAP program, that leaves hundreds of thousands of cannabis users out there risking criminalisation, even though they're self-medicating, because they don't fit into the medical box that the legislation currently lays out. It's not on, it's not fair, the courts are backed up, it just doesn't make any sense. But I suppose what we need is action. I want to know who is actually taking part in this clinical review. What qualifies the people who are taking part to make these decisions that are impacting people like us sitting here every day without even having a conversation with us? So I want more transparency about who's actually leading this review, when it will be completed, and if the patient advocacy groups are going to be involved in it. Because how can we only be reading off a report? Why are we not listening to people who are actually being directly impacted? Like sitting right in front of you, like even the lack of media that's shown up today, I think is an insult to all the patients in the country who are fighting for safe access. And I hope to God that this is going to make some difference to their lives, that they feel like somebody is on their side, that somebody is fighting for them, because the health system certainly isn't. We're waiting years on an appointment to even get a consultant to consider applying for a license. And then when you do, the products you can get is either not good enough or cost too much. So the program as is not fit for purpose, and we can't go back to criminalising the 150 patients who have managed to get it legally. So I don't know what to say, only we need safe access, wider access, and we need it yesterday. Thanks,
Amy. Thanks very much. Stephanie, do you want to say a few words?
Yeah. So I suffer from a condition known as functional neurological disorder, and at the minute I have no neurologist in Ireland, and I have no consultant looking after my condition, and I do not currently have a medical licence for cannabis. Even if I was to get on the medical cannabis access programme, the Bedrocan strain would not suit me. It's an amnesia haze strain, and it does not work for chronic pain. It does not work for seizures, and it does not work for functional seizures, especially. If anything, it's going to make me a whole lot worse. So even if I can get a license for cannabis in this country, the only product that they're willing to offer me is not going to help my health condition. And that's the same for a lot of different patients in Ireland. If I lived 20 minutes over the border in Newry, I currently live in Dundalk, I would be able to get private pain consultants to prescribe me numerous different strains for a number of different conditions that I have, and work with me and find a strain that suits me. And if something doesn't suit me, they'll be able to adjust the dose and work with different products like CBD oils, THC oils. At the minute, the only option they have is Bedrocan, which is not worth what it is. My son suffers from epilepsy, and the first product that ever helped his seizures was CBD oil. And even CBD in this country, it's really, really hard to get a company that doesn't get shut down and to have a consistent supply of a good medicinal CBD. So even the fact that CBD has absolutely no psychoactive properties whatsoever, and the fact that that's even being denied to patients who would benefit from it greatly is a disgrace. The clinical review need for an expansion of the MCAP has to happen as soon as possible, because there are so many patients in this country who are missing out on being able to medicate freely. Like, I can't use painkillers. I'm allergic to opiates. I can't use non-steroid anti-inflammatories. All I have left is cannabis, and all I want is the right to be able to medicate the way I need to. I think that's all I have to say.
Thanks, Stephanie. Well done. Well done. Would you like to say a few words?
How are you doing, guys?
Just hold you on mic over there.
My name's Owen Curry. I'm kind of famous for all the wrong reasons. I'm the first person in Ireland to be diagnosed with my condition, which is fascioscapulohumeral muscular dystrophy type 2. It's a muscle wasting condition. 4 years ago, I had an accident in work after getting back to work. I had an accident 4 years ago, 5 years ago, and since then, I haven't been able to return to work. I've had every pain treatment under the sun that the government has provided. The only thing I've refused is a spinal cord stimulator on the advice of my pain consultants. I've been given ketamine infusions, opiates, you name it, I've been given it. They've all taken away years and months of my life. And even when you're doing these come downs, there's nothing to bridge the gap. CBD and cannabis is the only reason I'm sitting here before you today. I've tried reaching out to all the ministers. None of them are interested. I had to use a company called My Access Clinic to get a prescription for cannabis, medical cannabis, which is not, I cannot fulfill. I actually have to go to the black market because the government don't recognise my condition, my neurological pain, the chronic pain, and everything else that goes with me. Pharma drugs are not a way of life. They've killed more people and put more of my friends in very, very dark places. And I just wish that someone in the government and in the health department would actually listen to us for once and stand behind us and not put us with the stigma, and even our families, that we are cannabis users, we're medical users. Yeah.
Thanks, Owen. Fair play, man. Thanks for sharing that. And the final speaker is Olivia.
Hiya. So my name is Olivia. I'm 40 and I have fibromyalgia. So fibromyalgia is, you can't get much help in Ireland for fibromyalgia. There's not much to help with it. So I was lucky. I got a really good specialist consultant in pain, and I worked with him. I've been working with him for 5 years. 2 years in, I said, look, I have to try cannabis. And he was like, look, let's talk about it. I was lucky. He had come from London, so he had prescribed cannabis before. So that's how I got lucky. But that's where my luck ends. I have to pay €820 a month for my cannabis. Sorry now. I find it appalling. I find it disgusting. I have come up here from Cork because in Cork City, the amount of TDs I have gone to, not one of them. Some of them have promised me the world, as they do, and not one of them have come back to me. And I'm not standing for it anymore, because why should I? Why should I have to go down the opioid route? No one ever asked to become an addict. Never. okay? And I have a severe pain disorder. The opioids I have taken accidental overdoses so many times, because within an hour of fibro, that could feel like 10 hours of pain. And I'm after being through 6 opioids, and I don't understand what's happening. You know, it's scary. And all I want is to be treated as a human, as someone that wants to treat themselves with a plant, nothing that nothing that they're making up in the big pharma. I don't understand why it's so hard. It's a plant that I can plant out my back if I wanted to. Obviously, I don't. It's illegal. But what I'm saying is, it should not be left for me to pay €820. I get €850 disability allowance. That leaves me with €30 a month. I'm lucky I live with my dad. My dad pays for everything for me. I'm just appalled at the way I'm being treated constantly like a criminal. I'm hiding. And like they said, I'm lucky I have the ministerial license. I do get Bedrocan as well. And again, there's no way to know different, you need different terpenes, you need different strains. It's not all about THC. It's about CBD, CBG. There's so many different kinds, and all the government are focusing on is the THC content, and that's not enough. That's not what we want. We want a strain that a strain might be brilliant for me, and it might be terrible for the girls here. We don't know, and we should be allowed to respect ourselves and respect our bodies enough to actually go and find out about these strains, find out about how to use it. All I could do was smoke it. I've only started to try and make edibles because I started looking on the internet. It's ridiculous. There is absolutely nothing. The MCAP is at 50-ish people. The ministerial is over 100. That's over 100 people that are suffering. The only reason people don't come out and say it is because they're ashamed, they're embarrassed. They don't have the time. I'm going to be in bed for a week because I have to come up here from Cork today. I'm devastated. I'm being left. I literally feel like the government is trying to just wipe me out completely because I'm just getting nowhere with them. I've been on to the Department of Health. They have said that they do the ministerial license and the MCAP, but that the money side goes to the HSE. And then I got into the HSE, and the HSE, they just give me the same garbage. Now I am like this in my emails. I am begging, I am crying, I'm pleading, and no one's listening to me. And I'm just begging for help. I'm begging for my life back. That's all I want. And that's all I can do. Why can't we even just get the drugs payment scheme on our cannabis, the €80 a month? Why are they not using the 2 oleo, or the oleo, and there's another new one from Jersey, the MCAP people, 50 people can get access to 2 cannabis places in Ireland. And the 100 and odd of us, we have to send our money to Amsterdam. So the government are actually sending money out of the country when they have 2 cannabis places here that they have promised the license. They've obviously paid loads for that license because it's not easy to get. They're trying to help people. They've been capped at 50, and then the 150 of us are still treated like criminals. It's beyond disgusting. I'm absolutely appalled at the government, and I'm disgraced for being Irish at the moment, and I have always been a huge advocate of Ireland. But honestly, it's absolutely a disgrace when it comes to me wanting to put a plant into my body instead of putting opioids, knowing that I will get addicted. And then they'll stop my opioids, and then they will they'll say, oh yeah, you've had too much now, you're at the point you can't have them anymore. And then I'm back at square one. Like, I'm not addicted to cannabis. I can stop cannabis. When I'm going on holidays, I couldn't have any today. That's why I'm probably so jittery as well. I'm in a lot of pain. Like any other opioid, I'd be very sick. I'd be very sick if I had to stop them out of nowhere. And they're expecting me to do that with cannabis. So I'm just, I'll stop there now.
Thanks,
I've gone
Olivia.
well over 5 minutes. Sorry.
Yeah.
So, sorry.
Thanks for sharing.
Oh.
And thanks to everybody for sharing their story. I know it's not easy. I know it's not easy, but fair play just that you're sharing your story today. Just to call on the government, to look at people, as humans, and and to expand the program where you can get it, legally and be covered by the state because at the moment it's at a huge financial cost. So we have a number of minutes for a couple of questions if you want to put.
To Olivia, I found that like really upsetting because my Instagram inbox is a full-time job for a qualified therapist.
Mm.
And every person who finds me or finds my story online or sees an article or a post or a video, they're in the same state as you.
Yeah.
So desperate for support. They don't have access to mental health support. They don't have a regular consultant that you can keep in contact with. And so again, the onus is back on patients to look after and support other patients. And I don't know about you, but most days I don't have the capacity to look after myself, let alone be there for strangers is what they are usually when I first come in contact. And then we end up becoming really close friends because we have these trauma bonds. It's like we're in a domestically violent relationship with the state.
Yeah.
And there's just nowhere to turn. There's nowhere to turn. Like I'm at this, I don't know how many years now. Putting myself out there in the public eye, putting a tag on my back. And I feel like we're getting absolutely nowhere. So again, I call for transparency for who is actually doing this review from the Health Research Board. What qualifies them and constitutes them to be in a position to be on that board? That's a question that I would really love to answer because the patient advocacy groups need to be in the room. They need to hear real true stories like this because we're not making it up. We're not here for the most of us on this panel have borrowed money today for transport and for parking and for everything else. So we're not getting paid. The likes of maybe Mary Cannon and Bobby Smith think that we're getting paid to do this. And in fact, it's costing us far more than they could ever imagine, putting ourselves out here like this. And it's because of our integrity. We're trying to do the right thing for everybody that this is impacting. It's not just who you see here. There's hundreds of thousands of people in this position.
Mm-hmm. Thanks, Amy. Uh, anybody else want to?
On your story, I probably didn't get mine across, but I thought enough. You covered nearly all my life in that. Especially when I'm 42, I live in a mobile home, mum and dad's backyard in Dublin. And then the same disability alongside the living pension, I get an extra fiver. What's a fiver on that? It's 1 hour to go. We have our medication, but we need to pay for it a lot. Like they're even on a normal farm. We also have insurance, our car bills. We meant to be looking after my parents. They're 73. They're not meant to be looking after them. The government's the falls on deaf ears. We've read every TV, every minister over the last 4 years since my accident. I was pain free with my shoulder rebuilt in 2011. The third person in Ireland to have this. We can gym 4 times a week. This is a fit state of my life. I went from the end to lift like you can deadlift 63 kilos. You can barely hold a liter. I don't know if anyone just knows when trying to pour the bottle. Like barely hold the bottle of water in there. I'm right-handed. And it's just we're looked upon that it's like the government don't care about us.
Mm.
But you can get opiates easier than you can get paracetamol in your GP from your consultants. And you don't get a warning. The reason I got on opiates was this because it wasn't my system without my knowledge. When we had an operation, they put you on oxygen. I didn't ask them to put me on opiates. I know they're putting me on opiate-based drugs. I wouldn't have accepted it. But they don't tell you these things.
Thanks.
Sorry. Yeah.
Okay. Okay, we'll wrap up. Sharon, you want to say
No,
something?
okay.
I'll tell you. Yeah. So look, there's a clear message today from people that are here that when the clinical review happens, that the MCAP uh, expands. Because if it doesn't expand, the program I think will largely become redundant. Um, and it needs to expand to include other conditions. And it also needs to kind of change the criteria for those that actually can prescribe medical cannabis other than consultants. GP should be able to prescribe medical cannabis. So, I've been at this campaign for the last 8 years, and there's been kind of ups and downs. There's been a lot of downs, but what kind of the main kind of thread over the last 8 years is to kind of those, such as the people that have spoke here today, is that they've been denied legal access to medicinal cannabis, where it should be legal and it should be covered by the state. And that was the whole idea in terms of the Medical Cannabis Access Program, in terms of access, in terms of cannabis, and in terms of where it can be covered by the state. And for the 53 people that are on that program, that's good that they can get that. But there's thousands of others that could benefit from medical cannabis. And even the report by the Health Research Board indicated that there's very good evidence in terms of cannabis and neuropathic pain. That's just one condition, so it needs to expand to other conditions. So by the end of the year, we'll have some sort of answer whether the program will expand or stay as it is. If it stays the way it is, I think it largely becomes redundant, and we have to kind of really start from scratch. Uh, but I'm confident that the program can expand, because otherwise I think it will go nowhere. But hopefully it will expand. But by kind of your testimony today, say, look at cannabis, it's not for everybody, but it helps me, me. And why should you go nowhere else or go to the black market or something like go abroad? Why should I be kind of made to be illegal in my own country? And that's completely wrong. And that's always been wrong for the last 8 years. So that's what we want. We want the program to expand to include yourselves and others that can benefit from it.
The marginalised groups are being further marginalised because at the moment it is a social class issue. If you can afford to pay your 800 and odd or your 300 and odd, then great, you can have your medication. But if you can't afford it, then you have to go without. Like without my Susie grant for June and July, I haven't been able to get my prescription. I'm dependent on the Susie grant for being in college to be able to actually get my meds. So when I finish college, I don't know what I'm going to do after that. I don't know. So I really hope that by then we're going to be recognised and with dignity.
Yeah.
I just want to highlight one of the dangers of the black market cannabis
Yeah.
at the minute. Like, especially being a woman trying to access cannabis from different people in this country, they're not the best people to be wanting to deal with. And then also, if you do get cannabis, there's no guarantee of who's grown it, if there's been anything else put in it. I had a really horrible reaction to a cannabis product last year that I bought in the black market. I'm allergic to opiates, and I can guarantee you there was some sort of an opiate that was sprayed on that hand, because I woke up the next day in full withdrawals and had full head to toe body rash, and that's what happens when I have any sort of opiate product. Um, and just with the amount of people who are dying from night disease in the country at the minute, like the drug issue in Ireland is a much bigger problem, and the cannabis needs to stop being viewed as a drug and seen as a medicine, because it's stopping. It's creating a lot more problems. It's wasting Gardaí time. It's wasting courts' time. Do you know what I mean? There's people in prison for cannabis when there shouldn't be, and then there's people who are getting walking away from violent crimes. Do you know what I mean? I'm gonna stop now.
Well, look, thanks everybody for coming today, and hopefully we'll have some good news over the next few months. But we'll keep campaigning for better access, and we won't stop till we get better access. And that's what today's all about. Yeah, thanks.